Welcome to the Extraordinary Health Podcast. I'm here with your host, Dr. Paul Beckham. My name is Allie. We also have Liz here.
Hello.
And today we're going to be talking about orthotics and sole lifts and heel lifts today.
So what's the difference?
An orthotic is something you would place in the entire shoe. A heel lift lifts the heel.
Wow.
And a sole lift lifts
Your soul.
the sole.
Actually, your whole foot, yes.
Oh.
We are talking about things that you can put in your shoe that would help balance your body structure out. So I think a lot of people get confused about that, and I get patients in that have been other places, and they say, oh, you shouldn't use that at all. You should be using a sole lift instead of a heel lift, and that's what we're going to try and talk about here today to try and hopefully get this clear for everybody to kind of understand, when you shouldn't be using any of these kind of devices that you can put inside of your shoes or orthotics. So I guess we'll start off with orthotics here right now. Orthotics, are, I guess, the easiest way to kind of describe it. It's kind of like getting the negative impression of your foot, and then we literally have, custom prescription insoles then that are made that are that negative image to help support your feet, especially when you're walking on hard, flat surfaces. So that's probably the vast majority of people here. And think if you're playing even a sport, you're running on a court or something like that that's hard and flat, having an orthotic that's going to help, support your feet is going to cause you to have less injuries, less sprains and strains of the ankles, even knees and hips, because you can get things like extra cushion or absorbency type things added to the orthotics that help reduce the shock significantly. Can you guys think of, you can get orthotics made for any kind of shoe. We can even have, sandals made. You can have, orthotics made for cowboy boots. You can have them made for cleats. You can have them made for running shoes, dress shoes, work boots. Yep.
Yeah, they're like completely customizable to what you need.
So the big question is, I'll have patients come in the office and they'll say, well, I went to my medical doctor, physical therapist, whatever, and they said, you don't need those at all. Take those out of your shoes. Here's some exercises for you to do because that's all you really need to do. And I would say that's a little bit short-sighted. Yes, those exercises can help build up some of the strength in your feet and help you get that proper arch back. But unfortunately, once some of the ligaments that attach all the bones in your feet, of which there's 26 bones in each foot and 33 different joints. And if those ligaments get stretched out, you now need something to help stabilize that. It's just anytime you get a joint that gets to be loose, you need to have something there to help stabilize it or control the amount of motion or movement. The orthotics that we have in our office are functional orthotics compared to what are made typically, usually in a medical setting or podiatric type setting, or even some of the orthotics you can just buy off of a shelf. Those are made to be like a crutch. Those are for usually people who have very flat feet where they have almost no stability to their foot whatsoever. And the vast majority of people do not need those. In fact, that's where their compliance with orthotics is 50%. I would say between 40 and 60%. There's not a lot of people that are going to follow through with those because they become just very, very uncomfortable when they're trying to use them every day, especially if they don't have a flat foot to begin with.
Yeah, I can personally relate to that because I have been dealing with, I call it my weird toe, but I basically have a toe that I don't know if I have a pinched nerve. I've been to a podiatrist and he doesn't really know what's wrong, but I have like one toe that is constantly basically numb or it's in pain. And so he recommended me going to literally just Shields and buying this certain orthotic that I could put in my shoes, and it honestly just made everything worse. And so then I was just like, okay, well, I don't know what to do from here. And then I started working here, and we all were getting our feet scanned and getting the orthotics, and I haven't dealt with the like throbbing pain in that toe since I've started wearing my orthotics here. And we're on our feet for basically 10 hours a day.
Oh, I get my steps in every day.
Yeah, like, so I'm a believer in the 3-arch orthotics.
And that's the wonderful thing about the custom orthotics that we provide here in the office, is that they do address each arch of the foot. You may think of your foot as only having one arch, but there are actually 3 arches to your foot. And these particular orthotics, the brand of orthotics that we provide, they actually are a proprietary type of orthotic, where they are allowed to then address all 3 of those arches, where most orthotics that you get elsewhere are only going to address 1 or 2 of your arches in your foot. So this is more of a complete fit for your foot.
Yeah. And a lot of the other arch supports that you can pick up off of the shelf, or go to a store that they're going to find you an orthotic that fits your arch type. They're not customized. They're just trying to find something that's going to fit close to your foot, and it's not even worth probably what you're paying for them. I mean, it's kind of like going and buying reading glasses. You don't pay much to get reading glasses, and getting a pair of prescription glasses, which obviously, depending on what you need to get for a prescription eyeglasses, they're going to cost more. I find it kind of funny in that, the orthotics that we have here, for what people pay here, it's actually less than what some of these stores sell their orthotics for. Not the ones that you just pick up off the shelf, like a Dr. Scholl's or something like that, where you grab those type of orthotics, but some of these other stores that deal with feet, generically get you an orthotic, and if you're spending over $1,000 for them, you're just helping their advertising is all it really boils down to. I guarantee that the orthotics are going to work for you. Even the orthotic company, you have a full year to make sure that the orthotics work for you. Typically, if I do have people that are having any issues with it, it's usually that they're having problems with their feet, and I have to adjust their feet to help correct the problems that are going on. And once we do that, or deal with some of the soft tissue things that they have going on, I don't know of anybody I've had nobody bring them back that has had issues with the orthotics. And again, they're a functional orthotic, meaning that they help your foot function normally. They don't restrict it like the other types of orthotics that'll get made in a medical setting or podiatric setting. They'll make sure that your foot is moving as much as what it should, and not too much, though. So, I think that kind of covers most of the issues with orthotics there. Obviously, there's other things we can kind of get into. There's different materials that get used with them. And depending on, if a person's using them for construction, you're going to want some of the tougher coatings that they have to make sure that the orthotic lasts long for you there. Whereas patients that have things like, neuropathy, or they have diabetes going on, or really arthritic feet, are going to want some of the more cushiony end of the spectrum orthotics, so that they're not putting abnormal pressure on their feet, especially if they can't feel it. And then we don't want the orthotics to be causing them problems. So,
well, and if they do ever if anyone were to have an issue and wanted to get something adjusted on the orthotic, we can do that.
Yep.
We think things can change. We can get them adjusted.
We can send them back in and get them adjusted so that they are going to work properly for you. So,
right.
And
the one piece of advice that I would give, though, is always give your orthotics a fair chance. So don't overdo it or underdo it when you're kind of ramping up and getting used to wearing them. I probably was a little bit more conservative on the more conservative end of things. So first day I got my custom orthotics, I wore them for 1 hour. Next day, I wore them for 2 hours. And granted, that is a very conservative approach, but it worked for me because I knew if I wore them for too long, I wouldn't want to put them back in my shoe again if my foot started to hurt by the end of the day.
Yeah.
So you want to be kind to your feet. So don't wear them for 16 hours the first day that you get them because you will hate them and they won't feel right. Because what we're doing is, we're changing the way you stand and walk and apply pressure on your feet. And so if you overdo it the first day, you're going to be very, very mad about it.
We're trying to help just get the normal structure back there so you also have the normal function.
Mm-hmm.
And that's key with everything that we do in the office here. So I usually kind of tell people, try and wear them as long as you possibly can. As soon as they do start to feel uncomfortable, take them out of your shoes. If you had previous insoles, just put those back in. But it usually only takes, I would say, 2 to 5 days for 90+% of the people. Occasionally, it might take up to like 2 weeks or so to get used to them there. But a lot of times, yes, you're going to know within those first few weeks whether they're working for you or not. And most of the time, you're going to be like, oh my goodness, I can't believe I have been without these for this long. So I'm going to move on. I mean, the next big thing that we kind of want to look at here is, heel lifts and sole lifts. I mean, technically, I look at heel lifts multiple different ways. I mean, sometimes if we have x-rays on a person, especially of their lower back and hips and pelvis, we can actually even measure the leg length difference on the x-rays there, and we can just see where you're at. Typically, somebody who has a leg length difference underneath 5 millimeters, I don't even worry about because a lot of times, yes, we can probably adjust you and get that kind of corrected without having to use something like a heel lift. But if you get over that 5 millimeters up to around about 10 millimeters there, then we're probably going to have to use about an 1/8 inch heel lift, underneath either the insole of your shoe or add it to your orthotic. And, typically those people are the ones that are going to start to feel pain, especially like in one hip. They might even start to develop a little bit of a hip bursitis, and that's probably the first thing you're going to detect. You don't even notice that it's an issue of a leg length issue or that it's even a problem that's maybe coming from your feet that's causing the pain in the knees or the hips or even in your back for that matter. Because, think of like your tires on your car. If they're just out of balance a little bit, they just put a little lead weight on there and that helps to balance it out and it, spins nice and smooth. For your body, it's a little bit more like a house where we're looking at, like a foundation of a house. If the foundation settles, it's going to throw off all the doors and windows up above. Think of that like your joints. And pretty soon they don't work the way they should because of that biomechanical difference. So, one thing to kind of determine is do you need a heel lift or do you need a full sole lift for that difference is more the mechanics of your lower back really plays into it here. So if a person has a very decreased curve in their lumbar spine, they've lost the proper what is called your lordosis, we're going to want to use a heel lift because that actually helps to encourage or bring about the proper curve in the lumbar spine because it's lifting your heel up, it's letting your toe drop down a little bit there, and it rocks your pelvis forward slightly. And that'll help get better alignment of your lumbar spine and probably take some pressure off if you're having more. Probably a disc problem is usually what most people are going to have when they have that short leg and need just a heel lift. Whereas if you have an increased curve in your lower back and you maybe need something to get a little bit more height there, that's where you're going to want to go to a sole lift to get that whole foot kind of lifted up so that it helps to decrease that curve in your lumbar spine. Because a lot of those people then have what are called facet problems, which are the joints on the back side of the spine. Usually that's more sharp stabbing type pain. It's very uncomfortable after standing for prolonged periods of time. And that sole lift could help out by helping to significantly reduce, I should say, it should help reduce the curvature in the spine and take a lot of pressure off of those facet joints. So those would be the areas where you're going to want to look at, a heel lift or a sole lift type situation. And that's what we evaluate, with all of our patients when they're having problems like hip bursitis or chronic lower back pain. I'll even watch them walk after we do make some of these adjustments to make sure that when they're walking, basically everything is nice and steady and stable there. We don't literally see like your hips and pelvis shifting around a lot. We don't see your knees or your feet moving as much because we want to have them supported so they have the proper function and don't end up then causing that chronic stress, on a hip or your lower back. Have you guys seen that in any of the patients, like when we've done heel lifts with them in the office here, how that kind of helps smooth out their gait?
The gait, yeah. That's one of my favorite things to watch out for, honestly.
Watch how people walk.
Yes, I can't turn it off. I watch people's gaits all the time, and I'm like, ooh, that person's got low back pain. I can tell. But the neat thing about it is after they get their lifts or their orthotics, and then watching them walk again, and how much, and it isn't so much that it's that much more smooth and that obvious, but I love watching their faces and their reactions to it because you can tell that they're more comfortable in their stride.
Yeah. I think that's the one thing that my wife hates about me when we go to any place in public, like the mall. I'm like, oh my God, that person's hip has to be absolutely destroyed.
I do that too. I'm like, oh, their left knee, and you need to come in and see us.
I can't say that I do that.
I'm sorry. It's like once you start to see these things, you can't
turn it off.
You can't unsee
it.
So, anyway, it's March. Happy March, everyone. Came in roaring like a lion. But March also brings a really cool promotion to our office this year, and we're actually doing Arch Madness for the month of March. And so if you come in and get your feet scanned this month, the month of March, then we will enter you in for a free pair of custom orthotics.
Yeah.
And you don't even need to be a current patient if you're not. You can come in and get your feet scanned whether you are a patient of ours or not.
Free to get your feet scanned.
Yeah.
We're not going to charge anything for that. You're going to basically find out from there if you need orthotics or not. And if you decide that you want to get some orthotics, then, we can obviously get you set up and, get orthotics ordered for you for whatever you need them for, whether it be running shoes, dress shoes, cowboy boots, cleats, basketball shoes, whatever. Especially since it's Arch Madness, all those basketball shoes out there.
I'm getting
right?
them flip-flops.
And summer's coming
those
around, so there's
Birkenstock
Birkenstock style sandals you can get, flip flops. I mean, there's tons of different things. So might be something if you're interested in getting something to support your feet properly while you're out and about. Stop on in, get your feet scanned. If we get more than 20 people in here, and if we get up to 40 people, there's going to be two pairs given away. So
you might as well give it a shot.
Yeah.
Who
doesn't like free stuff?
Exactly.
No obligations. Just come in, get your feet scanned. If you need orthotics, you can decide if you want to get them or not.
You can wait to see if you win them for free, or
Yep.
and then wait and order them afterwards.
Yep. Because the orthotics, once we get you scanned, I typically give people 6 months, and then we might want to have to look at scanning your feet again here. So if you decide within that window of time, you can always just give us a call and we can get things ordered for you. So.
All right.
Thanks for listening, everybody.
Okay.
Have a good weekend.
Happy Arch Madness.